Welcome to Bonafide HPP, a podcast designed to educate and support the families and caregivers of those affected by hypophosphatasia. As a mother and caregiver, host Deborah Fowler has discussions about this rare genetic bone disease with people from around the world. Join Deborah now as she speaks with this week's guest.
Hello, and welcome to this edition of Bonafide HPP. I'm Deb Fowler, and today I'm joined by Dr. Stephen Petak, who's recently retired as endocrine head at Houston Methodist and is associate clinical professor at Weill Cornell Medical College and at Texas A&M. And also a fun fact, he's an endocrine consultant for NASA Johnson Space Center in Houston, which is very cool. So thank you so much for joining us, Dr. Petak.
It's a pleasure to be here. Thank you.
I'm super excited to talk to you about this topic today because it's something that I think many patients are concerned about, and that is the interesting topic of ELISA tests. And I think the reality is that most of us really don't think about the actual tests, the devices that are being used when we go to the doctor or to the hospital and have blood work done. But when we have HPP and we may have low alkaline phosphatase or maybe high levels if we're on enzyme replacement therapy, this can be more of a concern because alkaline phosphatase is actually an important factor in how the tests are run. So can you tell us a little bit about what are ELISA tests and what they test for?
Certainly. ELISA stands for Enzyme-Linked Immunosorbent Assay. It was developed in the 1970s. One of the first indications was in HIV antibody detection. It can be used for any antigen that protein-based hormones, for example, testing against other antibodies, so in autoimmune diseases, for example. So it has wide application on determining the concentration of various analytes. The ELISA test is been developed mainly because the previous testing was mainly based on radioimmunoassays. And the use of radioisotopes clearly is a main disadvantage of going in that direction. ELISA is very easily performed, does not use radiation, and is extremely accurate in most situations, although, as I'll explain to you, there are some interfering substances that could take place in some rare instances, but it's very uncommon to have that as a problem. It's widely used. Most testing that is ordered in the laboratory for protein-based and antibody testing and other analytes is ELISA-based. The other types of testing that can be done, of course, are mass spec testing, which does not rely on antibodies, and radioimmunoassays that still have utility in some instances. The spectrum of testing that can be done with ELISA is enormous, and I think that the consideration here with the alkaline phosphatase is that the direct assays, which use the proteins from the serum that attach to the bottom of these wells that are used in order to determine the assay, may pick up sometimes the strensic, which is the alkaline phosphatase enzyme hybrid molecule. And if it adheres to the well, it can then interfere with the enzyme systems that may use alkaline phosphatase as a detector. We can go into more detail on that, but the detection systems are usually based on either horseradish peroxidase or alkaline phosphatase. And if it's an alkaline phosphatase detector, then should there be any strensic still in the well at the time of the assay, that certainly can interfere with the results.
Yeah, and I think that's where we've had some concern by patients wondering, the impact of that interference, and is there a way to tell, because part of the challenge is a lot of times the lab technicians who are doing this blood work may not have any control over what tests are being used at the lab, or most of the time they don't. So what kinds of things should we be looking for, and do you think that when we're having these tests done, should we be looking for inaccurate results and having discussions with our, technicians or the physicians? What's the best guidance for patients who are on therapy?
Well, it's complicated because oftentimes, again, we don't know the detection system that's being employed for a given ELISA system, since there are various producers of these systems that use different detectors. The problem is going to occur with the alkaline phosphatase as the detection molecule that's attached to the antibody, the detecting antibody. In the streptavidin HRP system, for example, it's not an issue. With horseradish peroxidase, it's not an issue. So it's really the smaller subset of tests that you employ alkaline phosphatase on the detection antibody that might even have a possibility of interference. And even so, even if they use alkaline phosphatase, it's really only if the Strensiq is remaining in the well in which the detection system may be fooled. And that's mainly going to occur in the direct systems where the proteins are adherent to the bottom of the well. And in the antibody-based capture antibody systems, it shouldn't be a problem because you're going to wash away the other materials that would include the Strensiq molecule. So I think it's very, very small subset of these tests that are going to be a problem. Now, in order to find out if there is a problem, number one, if you can identify that alkaline phosphatase is the active reagent, then there is at least a possibility that there could be interference. It doesn't mean there will be. In very few assay systems is this a problem. In the a couple of studies with the magnetic bead system, which is a immobilization system, there was interference in certain thyroid tests like T3, free T3 and free T4. For other testing systems, it really hadn't been a problem. So I think the key is, number one, is alkaline phosphatase being used as a detection molecule on the antibody? Number two, is it a direct system or not? Since a direct system where you have adherence of all the proteins to the well may represent the more problematic situation, since the Strensiq might lock into the well, where it would not generally be anticipated to be a problem with the other systems, although that is not totally clear. There have only been a couple of reports of interferences. Thyroid test, free T3 and free T4 in very select types of assay systems. Testosterone using ELISA with a couple of different systems, but not in others, and oxytocin, and very, very rare other reports. So in retrospect, number one, if you already know the testing was normal before starting enzyme replacement therapy, and you get a result that's not anticipated, I think it's more likely that this is going to be a laboratory issue. And number two, if you get any abnormal result, it doesn't quite fit with the clinical situation, then I think doing a deeper dive into what might be going on, that this could be an issue, would show up. But I think the issue is extremely rare. It's only based on very, very few assay systems. And I think recognizing an abnormal test where it doesn't fit the clinical situation should prompt testing using another assay system.
Yeah, so that's what I think is a really important takeaway, and that's something that you mentioned during our first conversation about this is, if there is some sort of interference going on, chances are it's going to be pretty dramatically evident on the assay results, correct?
Yeah, in fact, in the case report with the testosterone level came back virtually zero in a patient that was on testosterone therapy. So, that's clearly a result that needs to be fully investigated, because it's certainly not what you would anticipate at all. Same thing in the situation with thyroid hormones, since the TSH assay may be in a different system. If the TSH is perfectly normal, but your free T3, free T4 levels are definitely not what you anticipated, I think looking towards the assay system as being the problem in someone who's on enzyme therapy with Strensiq is certainly a consideration. But these are extremely rare reports. They only involve very certain assay systems. And even so, I think that having an awareness that a result that's not as anticipated should prompt further study is really the key. And I think these are very rare interferences, and I don't think for a vast majority of patients it should be a problem at all.
And what about the flip side for patients who are not on therapy and just have very low, and in some cases, trace amounts of alkaline phosphatase activity? would you expect the same type of results on these tests for it to be, again, inordinately low to a point where maybe that's a signal that you need to use another assay as well?
No, I wouldn't anticipate that that would be an issue at all, since the detection system is using alkaline phosphatase in these assays that utilize AlkPhos. Having a low alkaline phosphatase would not interfere with that. I would not anticipate that a low alkaline phosphatase would have any any effect on those results, at least in what my understanding is.
Okay. You mentioned the horseradish peroxidase as the alternative test for aside from using ELISA testing. Is that something that patients should ask for? Sometimes, again, depending on the technician or the lab, you may not have someone who's aware of what the other tests are that are being used, or is that something that the doctor would have to determine after seeing an abnormal result and maybe having a discussion? What's your advice to patients on how to manage that?
Yeah, so most of the time when you order a testing out of the books, for example, it'll say ELISA-based test, so you know it's an ELISA system. I'm not clearly sure if it specifies the detection system or not, but I think that if that information were in the laboratory books, that AlkPhos versus HRP or biotin-based testing is the way the ELISA is done, that would really go a long way towards identifying potential problems. It's not just with enzyme replacement therapy with Strensiq, but also biotin. You know, it's clear that patients who are taking high doses of biotin in the systems that employ biotin as the detecting system, biotin can interfere with a long list of tests. And we see this regularly. This is a very common problem, whereas obviously the Strensiq issue is extremely rare. So biotin is certainly the major issue that's out there, is an interfering problem. And I think that if the laboratories were specifying the ELISA detection system, whether it's biotin, horseradish peroxidase, or alkaline phosphatase, it would be really easy to then go back to that book and say, gee, that was probably where the problem is. But without knowing that in advance, and I'm not sure it's easy to find that out without talking to the lab, I think just getting a result that's not as anticipated should prompt a discussion with the laboratory. But I think it's pretty clear that the lab should really document the detection systems that are employed for any given test in some easy to access type of way. And again, the biotin issue is extremely common and causes a lot of clinical misadventures that I think, again, prompt the need to really know about the detection system that's employed for ELISA.
Agreed. Just that the horseradish peroxidase, is that the only alternative test that you're aware of that's an acceptable substitute for ELISA testing?
Well, and ELISA, again, you have three different main systems. There's a lot of newer systems that are out there as well. But in general, it's either going to be a biotin-based system, a horseradish peroxidase-based system, or alkaline phosphatase. So I think those are the three that are there. You could either use an ELISA using a different detection system or a different type of assay altogether. You could use radioimmunoassay, you could use mass spec, and there are other types of assay systems that might be employed if you have some question as to the validity of the result. So again, this requires a little more head scratching than you would normally have to consider. But I think it's extremely rare to have an interference issue with these kits, since the detection antibodies, the capture antibodies, may wind up making it extremely unusual to have any tests that become abnormal in this setting with Strensiq. So again, when this occurs, it's going to be extremely rare. It's going to really prompt an investigation if it's a test result that you haven't really anticipated. And knowing the assay system employed may help you in figuring out abnormalities that you might not otherwise expect.
Well, I think you made a great point about the labeling of the testing and making sure that providers and technicians are able to see, which assays they're using and to be knowledgeable and make those choices. And We've been working in the past with the American Association for Clinical Chemistry, which I understand just announced a name change last year to the Association for Diagnostics and Laboratory Medicine. So maybe some more work with them to make sure that the labeling is clear and that practitioners like yourself have very clear lines as to which tests are being used for what purpose.
Absolutely. And I think, clinicians are going to question tests that come back not consistent with their clinical impressions. And I think the first step is to determine whether the test is the problem or not. That's like step one. Is the test really the issue? In which case, again, doing a different kind of test is very important when the testing simply doesn't match with what your expectations are.
Yeah, that's great advice, great conversation. Dr. Petak, thank you so much for taking your time to do this and to speak with us about this important topic. And, again, thanks for all your information and all of your wisdom about ELISA testing.
Well, it's a pleasure, and I'm hoping that at some point our ability to know what kind of tests we're actually using on a patient becomes widespread enough to where we can figure out these problems, because they obviously can result in misadventures on a clinical level.
Thanks again.
You're
And
very
that
welcome.
wraps it up for this episode of Bonafide HPP. Until next time, see you then.
This has been a production of Bonafide HPP, the official podcast of Soft Bones, the U.S. Hypophosphatasia Foundation. For more information, you can go to www.softbones.org, or to recommend a guest to be featured on Bonafide HPP, email us at info@softbones.org.